I think it's a great opportunity to come together with colleagues actually in our own practice. We're a big practice, as well as across different practices as well, and just to talk to people. Well, I was particularly interested in Dan Cottingham's talk on end-of-life care and the EPACs. That's quite topical because of the quality improvement work that we need to do for QOF, and obviously really important work anyway. And we've had practice meetings about it already, and I was hoping that would add to it, which it has. You know, it's raised more questions as well. Well, I've really enjoyed the session I've just done, which was about adverse childhood experiences and experience of trauma, and having a trauma-informed approach, which I've never heard of that term before. Quite a hard session in many ways, sort of quite an emotional session in terms of getting us to understand what it must feel like for people who've had trauma, and how we can help to communicate and engage with them, and how that in itself can be therapeutic. I think as GPs, well, as a GP, I often feel like there's nothing I can do, and that's quite a frustrating situation to be in, and obviously very difficult for patients as well. So it's really useful to just have a bit of a framework and increased understanding of that, and how important it is. Asking what has happened to you, rather than coming from an approach of what's wrong with you and, you know, what are your symptoms now and so on, but actually inquiring about what's happened. And I think that's a really important shift, so I'll definitely do that and seek to understand what's happened to people and why they have the struggles they're having now, and to be kind around that.